Dr. Harris, appreciate your time at this very difficult moment as the world is grappling with the swift spread of Omicron. Just how precarious a moment is it right now?
Hello, and you've put it very well, Bev. It's a precarious moment. It's a critical moment. One, it's in our hands to turn around, but one we have to take very, very seriously, and we have to take all the measures possible to stop transmission.
Tell us what measures you think are sensible right now.
So limiting the crowding indoors particularly, but limiting situations where large numbers of people from all different parts of communities come together. So those are the big mass gatherings. Limiting those is absolutely critical. Wearing the masks, particularly indoors, will make a very big difference. Having what we say is a careful Christmas, not huge gatherings. We're not saying you can't have small gatherings, but doing all the things that we have been saying for a long time, and I know people are sick of it, but doing them all and doing them properly. The other thing, of course, getting the people who are yet to be vaccinated. That's really important.
Well, let's talk about the vaccination side of things. We're seeing Israel now moving to offer a fourth booster after a 4-month period, after the third booster. Now, some countries are running at 4, 5, 10% of vaccination rates. How does that jeopardise the whole recovery from this pandemic?
So certainly for us, the focus of COVID-19 immunisation efforts really must remain on decreasing death and severe disease and protecting your healthcare system. So again, that's why I said you focus on the people who have yet to have their first dose, because they are the ones who are sadly filling up the hospitals and even worse, are dying. Now, introducing booster doses needs to be firmly evidence-driven and targeted to the population groups at highest risk of severe disease and those necessary to protect the health system. So we have seen certainly with older people, sometimes it's vaccine dependent, but this needs to be very much an evidence-driven decision. And of course, we are concerned that if the wealthy countries race to keep on using more and more doses, we're concerned that that will limit the supply for the countries that are still yet to even vaccinate their health workers.
Yet, by the same token, developed countries that have the wherewithal, the economic means to do it, continue to just push ahead with vaccinations. And there is vaccine hesitancy in a number of countries. How does that hold us back with this pandemic?
You've really hit upon one of the crucial things. And vaccine hesitancy isn't always hesitancy. It may be that for the individuals concerned, they couldn't get a vaccine on the day they went to get it and they haven't gone back. They're people who are very busy and don't see getting vaccinated as top of their priority. There are some people who are very anxious about some of the information or misinformation that's around and need some help. But so it's much harder to unpack, but it needs to be unpacked. There are entire communities who believed misinformation and didn't understand the need for vaccination until members of their own community started dying. And that's too late. The point of vaccination is to stop people from dying.
You have also, though, cautioned against widespread lockdowns. Why so?
So we don't like lockdowns because of the severe economic and social effects, and also the deleterious effect on people's mental health. People who are already isolated become very isolated and suffer enormously. Now, governments get to a point where nothing else is working, when they've got the health system overwhelmed, and they really don't have much of a choice. And a lockdown will bring the transmission down because you're basically putting the entire society in quarantine. So they do work. But the other problem is they're also quite difficult to get out of. So that's why we say, as a community, work together to bring the transmission down so that you don't get to the point where your leaders, your authorities have little other choice.
So more of a consensus than a social responsibility. As Scott Morrison has said, there's no necessarily going to be a mandate for mask wearing, but it's about social responsibility. Is that the kind of right approach, or do you think there needs to sometimes be a sort of clearer and more direct edict?
Well, certainly something like mask wearing indoors really works. It's really protective. It's a really good thing to do, but not everybody feels the same way. So in societies where people are not doing it or not comfortable doing it, you may end up needing to have rules just to help those who have to enforce it. I often pity the security guards and the service staff who have to ask people to do it and get a really unpleasant reply. So sometimes having a rule helps them. But we find it is always better if the community understands how important the thing is and does it, like wearing seatbelts.
You know, it's probably showing itself to be the fastest spreading variant so far of this pandemic. When will it become clearer, do you think, just how virulent it actually is, how sick it's going to make us?
That is the big open question. It is very clear already that it's the fastest spreading form of SARS-CoV-2 we've seen, and some infectious disease specialists are saying it's the fastest virus they've seen. So, and it's certainly replacing Delta very quickly, and Delta had moved very quickly in the societies it took hold of. Yeah, I think you saw the same thing in Australia. So yes, Omicron is a very fast-moving virus. The question about severity is still open, but unfortunately, hospitals in many of the European and American regions that have now got a lot of Omicron are certainly seeing their intensive care units fill. We are hoping that vaccination will keep those numbers down, but that is still an open question.
Dr. Harris, really good to talk with you, and clearly we are still far from coming to grips with this pandemic. Thanks so much for your time.
That's a pleasure, and wishing you all a safe Christmas.
Likewise. Thank you so much for all your work.